When we are triggered, we are immediately launched upon a timeline. And this comes from the work of W.D. Cannon, who did research on fight or flight responses. The minute I perceive a threat, my body gets into a physiological state of anxiety. Anxiety is not a feeling, it's a physiological state the body gets into because of complicated feelings. Cortisol, adrenaline, noradrenaline, epinephrine, norepinephrine are all getting into a feedback loop. I might look quite calm on the surface, but inside I'm experiencing symptoms of anxiety. The intercostal muscles lining my rib cage are starting to seize up. Some people get the tremors a little bit. My face gets flushed and red. My throat starts to constrict. We're breathing more shallowly. This is the heightened physiological state of anxiety. And then when the trigger is either removed, they storm off, or it's somehow resolved, we drop fairly quickly back down, not just to stasis, but a little bit below stasis. We're now in relief. The body is physiologically depressed. We're breathing a little bit more slowly. Our heart rate has now returned to actually a slower level than it was before. And then, as I think about it afterwards, even though the trigger's not in front of me anymore, I start to get keyed up again. I come home and I ask my spouse asks me, how was your day? And I say, you know what? I had to work with Dr. X again. And my jaw is getting clenched and my eyes are getting all dilated. I'm starting to get keyed up again, even though the trigger's not in front of me. Sound familiar? At the exact same time this is happening in our bodies, there's a mirror effect about how we process information in our brains. In this area of the brain, the executive center, is located largely in the prefrontal cortex of the brain. This is where I ask you, what are you going to do in a few minutes when this video clip is over? You may not know, but a whole bunch of neurons are firing right now in the prefrontal cortex of your brain as you're thinking about the future. As we get more keyed up and anxious and into physiological arousal, this area of the brain slows, and this area of the brain becomes red hot for activity. There are a few glands back here. The amygdala is the one we're going to zoom in on. We call this an amygdala hijacking. The more I perceive the threat and allow myself to be swept up in it, neural processing shifts to the back of the brain where I start to feel cloudy. I'm not sure how to respond to this, and I'm now in fight or flight mode. So what do? There's actually really only 3 steps, and they're not rocket science, but practicing them and getting skilled at doing them when you are in the moment is not easy. The first step is cueing air. You can't cue air unless you notice that you are being triggered. I'm asking each person watching this video in the next 24 hours to go back out there and notice your triggers. Driving along, somebody cuts you off in traffic, notice that, oh, that's one of those things. Everything flows from noticing the trigger. And as you notice the trigger, force oxygen into your bodies. Diaphragmatic breathing is best. Your tummy should actually stick out a bit. Breathing from down here, imagine vents in the bottoms of your shoes pulling air from down there. You don't want to be breathing shallowly up here. It doesn't take everything away and you go to your happy place and now you're perfectly fine. All we're trying to do is blunt that anxiety experience. Keep forcing air in. This is not just kind of woo-woo, somebody's opinion out there. This is physiological, clinical fact. These are facts we know about how we manage anxiety. If you go to the hospital yourself in a state of heightened anxiety, they will treat you with oxygen. Oxygen interferes with adrenaline and noradrenaline getting in a feedback loop, epinephrine, norepinephrine getting into a feedback loop. Force oxygen into your body to deal with that physiological response. Now, we need a second step for what am I going to do with what's going on in my brain. In my profession, we say, refuse the bait. This comes from the work of a woman named Suzette Haden-Elgin, last name hyphenated. Haden-Elgin. She wrote a great little book called How to Disagree Without Being Disagreeable. The minute that you notice you're triggered, force air in. That nurse who's being so aggressive and angry at me right now, that doctor who's being so abusive or disrespectful to the patient, say to yourself, that's really good bait, and I'm not going to take it. Use your inside voice. Don't say that out loud. Inside voice. That's really good bait, and I'm not going to take it. And instead, move to step 3, which is acting out your strategy. We're going to look at step 3 in the next video clip, but we're not going to be able to get to that at all unless you're able to notice that you're being triggered, force the air in, we call that cueing the air, refuse the bait, and now act the strategy. I'm Roy Johnson from the Neutral Zone.